All right. So, hi everyone. As I already said, my name is Bethan. I am the academic director here at SLC. At heart and by passion, I am a teacher. So, as I already said, I've worked for many years in English language education, and now I'm here at SLC. So, at SLC, we are a fully online training organization and have always been online. This is so that we can work specifically with doctors and nurses and healthcare professionals who have very busy lives and various shifts, and we can fit in with an online environment and your shift patterns. So just a little bit about SLC. So SLC is as I said, an online training provider, and we specialize in English for healthcare. So we provide IELTS, we provide OET, and a multitude of English for healthcare courses, including English for doctors and English for nurses and clinical communication skills. So just to give you an idea, we're very focused on the healthcare English for healthcare. Today I am going to talk about OET and IELTS, and we're going to go through some tips for success. So specifically, I am going to talk briefly about the IELTS and the OET exam formats and the required English level for GMC registration. Then I'm going to go through some tips for each of the skills and vocabulary. The tips are quite focused on if you are preparing independently or perhaps with friends or colleagues. So there's lots of ideas of what you can be doing to prepare yourself for these exams. And then I'll talk briefly about preparation with SLC. All right, so we are going to talk first of all about IELTS. And I would like to come to you. So I'd like you to come to the chat box, please, and share your experiences. What do you already know about IELTS? Are you familiar with the test? Do you know what is involved in the test? What are your feelings around IELTS if you have some experience already? So if you can come into the chat and share your ideas. I'll just pop that question into the chat there. Okay, great. Yep, it is. Absolutely. It's an English language test. And thanks, Ori. So it's academic. So there are two versions of the IELTS. The one that we're going to be focusing on today is the academic version, which is the one that you need to come to the UK and register with the GMC. All right. Okay. All right. So let's take a look at, excellent. Yep. We have different sections. So we have reading, listening, writing, speaking. It's an expensive and challenging exam. Okay. Yes, absolutely. Certainly challenging. So it's great to spend some time preparing before you sit the exam. Absolutely. And it's a proficiency test. Absolutely. So it's checking your ability in English. All right. Thank you very much. Okay, so let's take a look at the format of the listening and the reading. So a very brief overview of each of the different parts. So the listening is approximately 30 minutes. There are 4 parts and 40 questions. Parts 1 and 2 are focused on everyday social situations, and you hear a conversation and a monologue. Parts 3 and 4 are focused on education and training, and you hear a conversation between 2 or 3 people in part 3, and then part 4 is a monologue, so it's a talk or a presentation. So what you'll notice about this part, the topics here, is that they are focused on everyday social situations in education and training. They're not medical specific. The IELTS exam was originally designed for university entry, so there's quite a focus on topics, generic topics that might come up for university students. So education, training, conversations in parts 3 and 4 between perhaps two students and a tutor. So if you're currently studying at university, there'll be the kind of conversations that will be familiar to you, but on a variety of different education and training topics. The listening test. So again, there are two slightly different versions of the IELTS. We're talking today about the academic version of the IELTS. So in the academic reading paper is 60 minutes, 3 parts, 40 questions. Each part has a reading passage, and each of these passages is between 700 and 900 words, and the passages increase in difficulty. So you have 60 minutes to answer 40 questions and 3 passages, quite a lot of text to deal with within those 60 minutes. The topics can include science, history, geography, and technology. You will need to answer questions on each of the different texts, and you have quite a wide variety of question types that you will encounter that are designed to check, as we've said before, check your English language proficiency. In the writing paper, so overall, the writing paper is 60 minutes, and you have 2 tasks. So task 1 is 20 minutes. You need to write at least 150 words, and you need to write about a piece of data or information. And the types of data or information that you will encounter could be a line graph, a bar chart, a pie chart, a table, a process, a map, or a cycle diagram. So there's quite a variety for you to become familiar with here. And you need to write about what you can see and what is represented in the graph, and you need to make comparisons and present the information in a clear and factual way. You have 60 minutes for the whole test, and you're advised to spend 20 minutes, but it's very much up to you to manage your time quite carefully in the exam. So as you I think the majority here are you're currently medical students, so you should be very familiar with time management in an exam situation. So you have to be quite strict with yourself to just spend those 20 minutes on task 1. And that's really important because task 1 is worth fewer marks than task 2. So as you can see, task 2, you have 40 minutes. You need to write at least 250 words, and the task is an essay. So this is worth more marks. So you need to make sure that you spend the adequate amount of time on it. Again, the topics are quite general. They're not medicine specific, so it could be education, environment. They're wide ranging, and they should be suitable for an international audience. And it's a good idea to be familiar with the different types of essays that might come up. So for example, we have advantages, disadvantages, problem solution, or maybe a specific question. One of the things to be careful with in your essay writing is to write clear paragraphs and make sure that your ideas are presented coherently and you are using cohesive devices throughout. And make sure you answer the question. So this is quite a key thing to remember when you're in the exam. In the speaking, so the IELTS speaking is 11 to 14 minutes, one-to-one with an interviewer. So it will be you and the interviewer is also assessing you at the same time. You have 3 parts. Part 1, you have questions on a familiar topic. So things about, for example, your work and your family and hobbies. Part 2 is a talk. So you will be given a card, and you need to talk for 1 to 2 minutes using the card as a guide. Then part 3, you answer questions related to part 2. So whatever the topic is for part 2, the questions will be related. This is your opportunity to expand your answers, give your opinions, and share your ideas. And the questions can be slightly more abstract. So part 1 is very familiar. You talk about things that happen in your everyday life, whereas part 3 is more abstract, and you need to give your ideas and opinions. All right, so that's a very brief look at IELTS. And now I'm going to do the same for the occupational English test. So the occupational English test, again, is a test of proficiency. So your English language proficiency. And I think it's important to remember this because it is a test of your English language, but in the context of medical English. So it's not a test of your clinical skills. It's not a test of your medical knowledge. It is still a test designed to test your proficiency of English. So the OET test is actually designed for 12 different professions, which I'll talk briefly about in a moment. There are 4 parts: the listening and the reading are the same for all 12 professions. So when you take the OET exam, you may be sitting next to a nurse, a physiotherapist, a vet, for example. So they're the same for all professions. So they're of a general medical interest. Writing and speaking is profession specific. So you'll be writing as a doctor, you'll be speaking as a doctor. These are not in the OET exam, it's not usually it's not specialist doctor that you're writing or speaking as, but more a general doctor. All right, so the listening has 3 parts. So part A, you will hear 2 consultations. They are on, the topics are not linked, and your task is to listen and complete a set of notes. So you need to write down exactly what you hear. So this is testing your ability to follow a conversation and pick out key information. Part B is about 10 minutes. You hear 6 short dialogues related to the workplace, and you have a multiple choice question per dialogue. So you'll see the context and you will have a question and you need to listen and choose the correct answer. And then part C is about 15 minutes. You hear 2 dialogues, often a presentation and an interview, and you need to answer multiple choice questions. So as you can see, there's quite a lot of text for you to read. So as you're preparing for the listening exam, you also need to build up your ability to read through and pick out keywords and information quite quickly before you listen to give you the best chance of achieving a high score. In the reading paper is 60 minutes. You have part A, you have 4 short texts on a related theme and 20 questions. The questions are, you have some matching questions, so you have to work out which text the information is contained. And you have gap fill questions and you have short answer. So this is only 15 minutes, no more time. After the 15 minutes, your paper is taken away. So it's very much testing your ability to find information and record it quickly and accurately. So those are the kind of reading skills that are required for reading A. Part B and C is together, so it's 45 minutes in total. Part B, you have 6 short texts and multiple choice questions. Again, these are work-based place texts, so you might be reading memos, emails, or guidelines, for example, and you need to answer questions. And then part C, you have 2 longer passages with multiple choice questions. So these are academic style texts, but they are not quite journal articles. So the text will always contain opinions. So perhaps an opinion on a particular piece of information or study, and you need to answer questions related to that. In the writing, so the writing is 45 minutes in total. You have 5 minutes reading time, 40 minutes writing. You need to write a letter. So there's only one task in OET, a letter based on a set of OET case notes, and your letter needs to be 180 to 200 words. You will need to write a referral, a discharge, or a transfer letter to another healthcare professional, specialist, or colleague. So this paper is testing your ability to read information, pick out the key information that's relevant to your specific reader, and write it in a suitable letter format. In the role play, in the speaking, you will do 2 role plays. So you'll play the role of the healthcare professional. So you'll be speaking as a doctor, and the interlocutor, the person you're speaking to, will play the role of a patient, relative, or carer. You're given a task card and time to prepare, and then you need to manage and lead the conversation. At the end of the first role play, your card's taken away, you're given a second one on a different topic. The one of the differences between OET and IELTS is the OET assesses your linguistic ability and also your clinical communication skills. So this is part of the assessment. So during the role play, you're assessed on your language, but also on your ability to communicate in a clear way. For example, they'll be looking at your ability to build a relationship, understand the patient's perspective, and demonstrate exploring ideas, concerns, and expectations, providing a structure, gathering information. So are your questions effective to gather information and also give information? So are you giving information in a clear and structured way? And are you employing chunking and checking to help manage the conversation? So as I mentioned briefly before, there are 12 different professions for the OET exam. So if you choose to take the OET exam, we strongly advise that you build up your knowledge of common terms in English related to the 12 professions. You don't need any specialist knowledge, but an idea, for example, with dentistry of common conditions, treatments, symptoms, will be helpful for you in the listening and the reading part of the exam. For example, in listening A, you may hear a dentist talking to a patient, or you may hear a podiatrist talking to a patient. So the more familiar you are with the key terms and the spelling of those key terms, the easier you will find it to complete listening A accurately. So the required English level for GMC registration. So the English language level that you need to demonstrate is the same in OET or IELTS. So you need to demonstrate a C1 level of English or advanced level of English. So 7.5 overall in the IELTS exam and 4 Bs in the OET exam. So it's always a good idea to be aware of the exact requirements. And at the moment, the GMC has these requirements for IELTS or OET. So a couple of things to highlight. For IELTS, you need an overall score of 7.5. No lower than 7 in any part of the test. Make sure you take the academic version. You get all the scores in the same test, and you do the scores are in the most recent sitting. One thing to really notice here is you cannot use IELTS indicator or IELTS online test. You need to do the paper-based IELTS test. OET, you have 3 different options with OET. You can do OET on paper, computer, or at home. You need to do medicine, and you need to make sure that you achieve your grade Bs in the most recent certificate, and that you achieve Bs all at the same time. All right, so we're going to briefly go through some tips and ideas for listening. So if you are studying independently and you are studying on your own, I'm going to go through some tips and ideas to help you. I may skip through these ideas quite quickly because I've just got 5 minutes left, and we'll be sharing these links with you and the slides after the end of the conference today. So tips for listening. Make sure you know what the text types are and the exam questions are, and think about strategies for each of the different question types. Use the past papers to practice these strategies. Make sure you listen purposely and work on improving your listening skills. So one of the things that we find with students is they can often focus a lot on past papers without focusing on improving listening skills. So just be aware of this as you're preparing. So listening skills can include, are you able to hear individual words in fast speech? Can you write down the words you hear and spell them correctly? Can you understand the speaker's attitude? Very important for OET listening C. And can you understand a range of accents? So if you're studying independently for your IELTS without a teacher or in a school, really think about how you can improve the skills that you need to be successful in listening. One of our favorites and one of the ones that we recommend a lot to students, and you may be familiar with already, is TED Talks. So there are some specific healthcare talks that can help with your OET, listening skills preparation, and then a huge variety for IELTS topics. Make sure you think about the skills that you're practicing rather than just listening, maybe writing down words you don't know or listening passively. Really think about how you're going to improve a specific skill when you do some listening. So tips for reading. Again, make sure you understand the different question types and exam strategies, especially important for IELTS because there's a wider variety of different question types in IELTS. Any of you who've done the test before may be aware of the true, false, not given questions, which can be quite tricky. So make sure you've got a variety of strategies there. The biggest tip is read, and read some more, which if you're currently studying for your medical degree, I imagine you're doing a lot anyway. So just make sure you think about how you read and spending time reading for the types of text you'll get in the exam, and think about the different ways that you read. So again, really thinking about the skills that you need to work on and develop. One of our favorites, which you may know already, is the conversation.com. So you've got health for OET, and then you've got a variety of different places for topics for IELTS. Writing, again, I'll go through this fairly quickly. So a couple of things to notice. Make sure you understand the format and the timing. Review sample answers for IELTS. Review this review the answers for academic language. Make sure you familiarize yourself with the type of language and vocabulary you need. So vocabulary is a really key point in IELTS. So make sure you're aware of how to explain changes in a graph or sequences. Task 2, really think about the different essay types you'll get and practice answering the questions and think about your essay structure. All right. For OET. Okay, let's go through this fairly quickly. Review past exam papers and then really analyze this. So one of the big things in OET that students struggle with is choosing the content that needs to go from the case notes into the letter. So when you're looking at sample answers, look at the case notes, look at the sample answer, and notice what is included in it and what isn't included. Also think about what the examiner is looking for. So be familiar with the assessment criteria, which you can find quite easily online on the OET website. Think about how to approach the writing. So here are some of the steps that you can follow. So similar to any steps that you would already be doing for any writing exams. So we recommend you look at the case notes, find out who you're writing to, decide what information is relevant and not relevant, make a plan, really key in both OET and IELTS to really help manage your time and expand your thinking time. Write your letter and then check for errors. Okay, very briefly, tips for speaking. So in IELTS speaking, a couple of things really. For part 1, make sure you practice giving your answer quite short and you give a reason. 2, practice speaking for 2 minutes. 3, practice giving your opinion. And as you can see, we've got vocabulary highlighted in pink here. Again, really focus on having a variety of specific vocabulary on different topics. And there are a wide variety of resources you can use for expanding your IELTS vocabulary. For your OET speaking, think about how you're going to do the exam. So you've got your tips there. Think about how you can demonstrate good clinical communication skills in the language that you can use. Remember, it's a language exam, so you need to express everything in words. The OET exam is only recorded, the audio is recorded. So you're not able to rely on facial expressions or body language. You need to voice all of your clinical communication skills. So really review and practice useful phrases. Okay, and for example, here are a few examples, which I think you could review in the recording or afterwards. And finally, tips for vocabulary. I'm aware I'm going very over time here. My sincere apologies. I'm just going to go through vocabulary and then I've got a final couple of tips. What I'll do is I'll put our resources tips into the chat box after I finish speaking. So vocabulary for IELTS, make sure that you really review a wide variety of topics. So again, like we said, one of the biggest things in IELTS is having the vocabulary about different topics and also having opinions. Sometimes I find that students will say, well, I've never really thought about whatever the topic is. So really make sure you review vocabulary relating to different topics. And also you take that vocabulary and you think about what are your opinions on these different topics and what can you say in an IELTS essay, or what can you say in an IELTS speaking exam relating to a specific topic. For OET, think about developing your vocabulary on common illnesses, the 12 professions. For reading and listening, think about making sure you understand formal verbs. And C, as I mentioned before, one of the differences with the OET reading is that there's quite a lot of opinion-based questions. So you really need to practice looking at the language that you have that expresses opinions. And it's often very subtle. So words like unusual, unexpected, or surprising come up a lot in the OET reading. So make sure you're familiar with those. Resources, I'll pop these into the chat after, as I mentioned. So at SLC, we have a variety of free tips, strategies, short videos. So we have our YouTube channel with OET Joe, who focuses specifically on OET, and we have lots of videos to help give you ideas, tips, understand the format of the exam. So overall, our tips for studying for your exams, your English proficiency exams: be organized, be methodical, be reflective. So a few of the ideas that we have from Dr. Preeti before, really helpful. So things like Quizlet, the Pomodoro method, which I'm certainly going to explore in my own work life at the moment. Make sure you select your resources carefully. I think this is really important for OET. There are a lot of resources, but a lot of them are not good quality. So really critically analyze what resources you're using and use the official OET site to help work on improving your skills and work with a teacher if that is a possibility. So on that note, finally, if you are looking to do some preparation and you are taking your exam soon, we have a variety of courses at SLC. So we have individual coaching. We also have online self-access courses. And we have a discount code for the attendees today. So we have a 10% discount code that's on the screen. So this is available for the next week. And this is for online self-access courses. So we have Reach IELTS, which is a self-access course to take you through understanding the exam and practice. And we have Reach OET Medicine to help you with your OET exam. All right. Thank you so much.